Hello and welcome to this edition of the Podium, which is coming to you live from the Sierra Leone Broadcasting Corporation with me, Asmiba. Coming up in this edition of the program, Sierra Leone Association of Social Workers urges government to scale up actions on how to combat KUSH in the country. We are back with the program Podium, which is coming to you live from the Sierra Leone Broadcasting Corporation. The Sierra Leone Association of Social Workers has pointed out on a press release that call on governments to improve on the way how they could address the issue of rate of KUSH, which is alarming rise in the country. Well, many young people are now in this business of KUSH consumption, which has led to serious societal issues. Well, this year's theme, mental health is an unequal world, resonates deeply with disparities and inequitable access to mental health services, especially by vulnerable people. Well, this menace, if not nipped on the bud, will deprive the country of a very critical workforce. That's the young people. Well, to tell us more, we have Musa Kargbo, who is the Vice President of Sierra Leone Association of Social Workers. Welcome to the program, Musa.
Thank you, Mr. Ba.
Okay, what's your specific call? Because I know the government has scaled up this issue of KUSH consumption. Certain things have been activated to see how it can be minimized in society, because the trend it is going. Something urgently needs to be done.
Sure. So that is why we are coming to reinforce, because this time around we want to see tangible actions at community level. We have seen a lot of proclamation on governments on certain issues, but to actually see the real result, it's very difficult. So that is why we are coming again as partners for development, to see that government actually take tangible actions in terms of establishing rehabilitation centers.
So you're asking for rehabilitation centers, right?
Sure.
How many rehabilitation centers do we have presently?
Currently, we only have the Freetown Psychiatric Hospital, only one. Even for the Freetown population, that one cannot serve the Freetown population. So I cannot even talk about the entire, about 8 million or so population. So we really need serious investment.
But not all cases should be referred to the place at KISI.
Yes, yes. At KISI actually deal with chronic, that has to do with medication. But in other situation, that is why government need to integrate social work services across community level, because some of these issues need urgent attention in terms of early identification. We cannot sit and wait until the problem escalates as we have it now. So the need for social work integration in Sierra Leone is really needed if actually we want to overcome the social issues.
Do we have the number of social workers that we need when you look at the current social problems, especially those who are engaged in antisocial activities and also those who are in the habit of drug misuse?
Sure, the number is not a problem.
Really?
Yes, of course, because for the past, as for me, I graduated in 2017, and every year we have largest numbers of graduates from social work program across the country. So the problem is most of them graduating without job, because government itself has not taken the issue of social work practice serious. So that is why.
So that also adds to another social problem, the issue of unemployment. So those who are supposed to provide social services, they themselves need social services.
They need social services. They need job. So we really have serious problems, right? We cannot develop this way. Even now we are talking about hunger has become a serious problem. A lot of studies have highlighted that. Even the 2023 WFP report have shown that 78% of Sierra Leoneans are food insecure, and hunger is one of the factors of mental health. When you are hungry, it can develop mood swing, and things like that can actually contribute to your mental health. So we cannot overemphasize the services of social workers integrated across communities.
So, I mean, the most talked about drug abuse now is this issue of KUSH. And that social worker, what has been your intervention? What advice have you given to authorities to see how the country can reduce this? Because I don't think we can totally eradicate it for now, but we can reduce the consumption and the threats it poses to society.
So, for a matter of fact, the association is a baby. We launched it in March this year. So only last month we open up membership, because that we believe is one way. If we come together as a community, we can be able to be like, I cannot say a pressure group to government, but we can be able to be like a serious advocacy group to see that the government is able to put in place certain policies. Like for now, we don't have a consolidated social welfare policy that can be able to address some of these problems. So the area of KUSH, I think social work can play a critical role, as I said earlier on, in the area of early intervention, treatment, also supporting families that have members that already become addicts. They undergo a lot. Seeing their children, they hope that they can become somebody in society. All of a sudden, they are now become a problem. So the need for also provide support to these families, to support these people, because most of the families has given up to these people, because they see them as if these are problem.
Are the black sheep?
Yeah, you see. So.
Okay. Continue with us. He is Musa Kargbo, who is the Vice President of the Sierra Leone Association of Social Workers. Now, Charles, Musa Kargbo, in just a few seconds, as time has passed, my coach is asking me to go. Will you be meeting the stakeholders and also those who are in this KUSH consumption?
Sure. That is our next drive.
Okay.
We wanted at national level to advocate for policy change and also laws, like we still have the 1902 Lunacy Act.
Okay.
We want to see that government.
That itself is a discriminatory act.
Yes.
The word in itself, Lunacy.
Of course, we want a law that can meet contemporary society.
Okay.
So also we are calling on our members to join in.
Okay.
We have 4 categories of membership. We have full membership. We have associate membership and honorary and student membership.
Okay.
So you can reach out for you to become a member.
Thank you very much, Charles.